Hi everyone. Now we're going to go on to something called TriLift. What is that? TriLift is a combination of radiofrequency and deep muscle stimulation. The effect of it is to tighten the tissues, get a rejuvenating effect, melt the meibum, but also to train the muscles of the face to work better. What muscles do we need working better for the dry eye patient? We need the orbicularis muscle working better, and we need the downward vectors of the face improved and lifted with the TriLift technology to improve the blinking and the efficiency of the eyelids. So we leverage this really clever aesthetic device for the dry eye patient. Let me show you how.
Our slip.
Yeah, this thin layer of glycerin, it feels really nice when it's on your skin, but it helps the device to glide across the skin as we distribute the radiofrequency energy and the deep muscle stimulation energy in the facial tissues. So we've done a thin layer of glycerin on one side of the face, and now we're about to apply the radiofrequency and deep muscle stimulation energy to the left side of the face first. There's a foot pedal to engage on the bottom, and we'll begin. And you'll start feeling some warm energy. It'll get warmer as time goes on, a lot like a hot stone massage. You might notice that it feels a little bit sparky or prickly. And if you do notice that and it's bothersome, let us know and we'll change the power settings so that that sensation is far more comfortable for you. So we're just going up on the power and on the deep muscle stimulation duration, the radiofrequency power, and the frequency itself. It'll be interesting. You'll notice over the next couple, 3 minutes that the sensation evens out over time as the tissues are warmed. There's something about the radiofrequency warming the tissues that makes the deep muscle stimulation sensation much smoother as you go along in the procedure. So one of the important things we need to do is apply this uniform application of radiofrequency energy coupled with deep muscle stimulation to get the tissues to a certain frequency. One of the concerns I see with other radiofrequency systems is the lack of constant temperature feedback. You need to be careful about the temperature that you use around the face. You don't want fat volume loss. There are certain areas of your body where you do want it. Around the face, you don't want it. So you do need to be mindful of the maximum temperature. Our goal temperature today will be 40 degrees centigrade. We can watch in real time as the temperature starts to increase. Always checking in with the patient. How are you doing?
The zapping is getting a little
snappy?
Little snappy.
A little nervy? Great. Well, we'll change those energy settings and see if we can relieve that for you. So for your case, the reason why we wanted you to take advantage of this service that we offer is the unique aspect of your particular dry eye. And that is the eyelids are lax. They've lost their normal windshield wiper capacity to wet and spread the corneal surface, the tears, in an even way. It's called floppy eyelid, and it's commonly associated with sleep irregularities or improper sleep, incomplete sleep, conditions such as sleep apnea. So with this technology, in a non-surgical way, we can strengthen the orbicularis muscle, which has injury. When we look at histologic sections with sleep apnea, there is damage to the orbicularis muscle from hypoxic injury. If you see this in your patient, make sure you have them do a sleep study and get an appropriate sleep apnea device to control their nightly hypoxic insult. Once that's controlled, come along with this modality to help the orbicularis muscle to re-strengthen and re-heal. If you've ever gone through physical therapy for an injury, you'll understand what I mean by radiofrequency and deep muscle stimulation. This combination of modalities is common in other fields of medicine. We're employing it for an aesthetic purpose, but also to help the dry eye patient. One of the fascinating observations we're making is an improvement in something called incomplete blinking. Patients that don't blink all the way are not spreading the tear film across the cornea, resulting in more dry eye symptoms. With this retraining technology, radiofrequency plus deep muscle stimulation with the TriLift system, we are seeing improvements in the rate of complete blinks. Every time we check this before each TriLift treatment in office, we're seeing an improvement in the number of complete blinks as captured over a 60-second interval by video slit lamp microscopy. So along with that comes a better feeling eye. a more comfortable eye. So we approach dry eye in this way with this musculoskeletal chronic inflammatory aspect with technologies such as TriLift. So one of the things you'll notice that the skin has a blush pink appearance as it's warming. It's not uncomfortable though. Would you agree with that?
I agree.
Yeah, it's not uncomfortable. It's just a light blush pink. Our rosacea patients don't flare from this. Radiofrequency is different than heat, UV, acids from your cosmetics. It's different. So with this technology, we're able to warm the skin and create that retraining of the deep muscles of the face to relieve these downward vectors so that the lifting vectors can be relieved on the orbicularis muscle, plus also retrain that orbicularis muscle that's been damaged from hypoxic injury from sleep apnea. But if you lean in close, come on, let me show you something. Look closely. You'll see there's a twitching of her muscles. Right now, the perioral muscles are being activated, and you'll see the risoris muscle of the face being activated as she passes over the lateral cheek complex. What you don't want to have happen is activation of this platysmal complex. That's a downward vector. What we're stimulating are the muscles of the face that are involved in upward vectors. So we're continuing to get this warming effect on the skin, this little twitching effect as we activate the muscles. There's even a little bit of orbicularis activation up here, you'll see. After this initial combination step, then we'll switch to straight deep muscle stimulation alone using the small probe around the orbicularis muscle to really get that muscle to retrain, to squeeze, to release meibum from this warm tissue situation. The combination of heating and then expressing under active muscle stimulation is really beneficial for patients. I don't want to put words in her mouth, so I'll be interested to hear the words she uses as she notices the difference between the two eyes and how they feel. I know which word I use. You know which word you use. But let's see what she says when she's done. So now we've finished phase one with the radiofrequency to heat the tissues to 40 degrees C combined with deep muscle stimulation. How was the comfort of that?
It was very comfortable.
Very comfortable. Now comes the really fun part. We're going to combine it around the eye. You're going to feel that muscle really contract. So now we're focusing in on the orbicularis area. That's the muscle I really need to retrain so that it can recover from the hypoxic injury of floppy eyelid syndrome secondary to sleep apnea. It's similar. These are smaller probes, so you'll still feel the warm. You'll still feel the little contraction with the deep muscle stimulation. After this periocular step, then we'll go along with just a DMST mode, and you'll really see those muscles contract and lift as a final training session. It reminds me a lot of having a personal trainer, and they start you off light weights, and then they progress you to reps, and then there's the final fatiguing set. It reminds me a lot of muscle training that you would get at a gym from a personal trainer. I call this the personal trainer for your eyes. One of the fun things to do with your patient is to sit them up halfway through the procedure and show them the difference between the treated and the untreated side. And we'll do that with our patient today. Now we can turn up the energy on frequency, duration, and power. Let's watch and see what happens and ask her what she's experiencing. You feel that contraction? Mm-hmm. It's so interesting, right? So we'll hold that area of contraction. We'll move it around about every 20 seconds. So you'll feel a different muscle group activating and engaging. You can blink, of course. But this contraction here, right after radiofrequency, is where the magic is with meibum being delivered out of the meibomian glands. They've been warmed, and now I'm using deep muscle stimulation to contract the orbicularis muscle to deliver meibum to the lid margin and the ocular surface. One of the things you'll notice as somebody who does these treatments a lot is the shine and the luster of the eyes in the treated side. The tear film is protected. There's more oils on the surface. It's really neat to see as an operator. I don't know if it's coming across as on the camera. This is my favorite spot when I have this done on myself. that combination where you're getting the contraction of the orbicularis muscle, the lifting vectors of the face, that upturn on the edge of the lip. To me, this is what feels the best when I have it done on myself. How about you? Mm-hmm. Yeah, that's my favorite part. The first time I had this done, and all my patients know that I don't ask you to do anything I haven't tried myself. The first time I had this done, I was blown away at how smooth and lubricated, and the best word I can really use to describe it is lubricious my eyes felt after this combination of radiofrequency and deep muscle stimulation. In our younger patients that need help with their incomplete blink, oftentimes you'll see a flattening of the midface or maxillary hypoplasia. When we have that combination of incomplete blink, dry eyes, meibomian gland dropout, and that midface appearance, we will often layer on neuromodulatory injections to the masseter muscle and the platysma to further neutralize the downward vectors of the face and enhance the lifting vectors of the face. And it's really satisfying to see the number of complete blinks per minute increase dramatically with this combination approach. As we're finishing up here, you can see how TriLift is very much a part of our practice philosophy of the Tao, bringing together dermatology, aesthetics, and ophthalmology overlaps. And where they meet in the middle is the healthy, beautiful eye. And we strive to achieve that for every single one of our patients. So we just finished side one, and we're about to sit her up to see what she thinks. But I'm also noticing an improvement in the contour of her jaw. This is called jowling, and who doesn't love that softened? And we'll see it in just a sec when we sit her up, but I can see it from here. So we're gonna have her sit up and look at the lift. Look at the softening of this tissue here, but just by using the elevating factors of the face. How do those eyes feel?
It's nice and moist.
Yeah. How about that gritty feeling that you had before?
I don't feel that at all right now. They're moister than they've been in a long time.
Yay. Is the other side jealous?
The other side is jealous.
Well, let's take care of that then.
Okay.